Welcome everyone to today's Wednesday webinar. We have Emily Odermann, who is a wonderful occupational therapist, and she's going to be talking to us about upper extremity ailments and ways to improve our bicycle riding by either fixing those ailments and also preventing them. So lots of amazing information coming right up. Emily, next slide, please. The next webinar, which will be 2 weeks from today, and we're actually going to touch a little bit about e-bikes actually in this webinar. So in 2 weeks, June 16th, also Wednesday, 7 p.m., we're going to have a webinar, everything you need to know about e-bikes. And so there's going to be some pretty basic information, but then it's going to be a big open house. Like, what do you want to know about e-bikes? What have you been thinking about? Have you wanted one? If you have one, like, what's the etiquette regarding using an e-bike on bike paths, on mountain bike trails, on the road? There's lots of unknown information. This is a pretty new piece of equipment for the bicycle world. It's probably one of the biggest ones that's growing very quickly right now in the manufacturing and bicycle industry. So pretty exciting information coming up on that webinar as well. Next slide, please, Emily. We also have the women's ride. This is coming up this weekend. We didn't have it for a couple years. And of course, now that we can do it again, it's the pandemic. So it's a little bit different. Even though we're coming out of the pandemic, it's going to look different than previous years. In the past, we had one big ride in Freeport. It left and returned to the LL Bean headquarters there. This year, we actually have dozens of rides all across the state, and they're each being led by a woman. They're open to everyone. There's no charge, and it'd be great for you to join one of these. Go to our website. You can get more information there. I'll put that link into the chat box. Next slide, please. If you want to know more by going to our website, you can go to bikemain.org, click on events, and then calendar in the drop down. Or you can just click on the women's ride specifically to see the women's ride information. Next slide. So now Emily's going to take over. Again, please use the chat window to ask questions. Feel free to unmute yourself. There's a lot of information in some of these slides. So you don't have to read everything. Emily's going to be pretty much going through it, but there are some people that prefer to see information written down. But don't feel like you need to read it. Just use your ears and enjoy our conversation. And don't feel free to interrupt if you have a question. That's what we're here for. We really, like I said, open discussion. So without further ado, thank you, Emily, for joining us. Go for it.
Hi, Eric. Thanks so much for having me. I'm really excited to be here tonight. This is like my two favorite worlds colliding a little bit. I am a hand and upper extremity therapist, so I spend a lot of my time looking at treating patients with hand injuries and shoulder injuries. And, you know, I spend a lot of time studying, so this is one of my passions of mine. And I love cycling too. I gravel bike and mountain bike and road bike. So hopefully I'll have some tips today that might be a little bit helpful for you. So I thought it'd be helpful to just make sure we're a little bit on the same page with some of the anatomy, because I have a lot of people that come in and they don't really know what the difference is between a ligament and a tendon, and those sorts of things make a difference with how we're going to treat a condition that's going on. So we'll take a look at that, and then we'll look at different common problems that people have for the shoulder, the elbow, wrist, hand, and finger. We're going to have to kind of zip through these things. I could probably talk about this stuff all day long, but we'll kind of zoom through it so we can get to the good stuff at the end with coming up with ways to modify and make your ride a little bit better. So we're looking at what sorts of things can we do for you, and then what sorts of things can we do to your bike so that you can enjoy your ride a little bit more. So we'll get started. So don't worry about this slide. There's a lot of information, but basically the point that I'm trying to make is that not all things can be treated the same. So we have to think about what's going on. Is it pain in your shoulder? Is it in your hand? the type of pain you have going on is going to determine what sorts of treatment's going to be effective for you. So some of the things we look at are your symptoms. So presumably you might have some pain going on. Is it an aching? Is it a burning, a sharp, like electric shock? Are you having tingling? Are you having numbness? Are you noticing difficulty with coordination or weakness, swelling? What types of symptoms are you having? And those will kind of lead us into what direction to think about what's going on and what we're going to do about it. Where are the symptoms happening? Because if it's on this side of your wrist, it's might be a different problem than if it's on this side of your wrist. And that's getting a little bit into the nitty-gritty of the anatomy and particular structures in the arm, but it's still good to think about and know that we treat those things differently. Another thing to think about is what particular movements or activities make it worse. Are there other sorts of things that you're noticing these symptoms with? Have you found some things that help relieve your symptoms, or are there things that make it worse? And has it been going on for a long time? And have you had previous history of trauma in the area? So those are sort of the initial things that we think about when we're looking at what's going on in the upper extremity with ailments. So when we're looking at bones, so these are the different structures that you're thinking about when you're looking at the upper extremity: the bones, the joints, the tendons, the ligaments, the nerves, and of course you have your veins and arteries as well. But is it in it generally, if you're going to have a bone issue, it's probably going to be because of a fracture. But we also want to think about like osteoporosis, and there's a lot of people that are ending up with weakness in the bones, and this is probably something that you'd want to think about if you're out riding, and might determine what types of riding you want to do. Also with fractures, you know, it's nice to think that we're back to 100% after we break a wrist or something, but a lot of times that's not the case. And, you know, those are things to think about with your riding, because those, you know, fractures can happen and you might not be back at 100%. When we're looking at the joint, you know, we're talking about arthritis, dislocations, and subluxations. And that's when the subluxation is when there's like a gap in the joint space, but it's not dislocating. Tendons connect the muscle to the bone, and those are involved with like your tendinitises, your tennis elbow, your golfer's elbow. And we'll see some pictures of those in the arm, because a lot of the tendons that go to your hand are more just the tendons than the muscles. And then the ligaments are what provides the stability for the joints. And then the nerves provide both sensory and motor function. So it allows you to feel and touch things, but also provides you with that ability to coordinate your hands. So this is a quote I found online a couple different places, but it seemed kind of appropriate, but I didn't hunt down to see where it came from. I didn't look at the article or anything. But 31% of cyclists experience some sort of overuse hand pain. So I thought that was a pretty high number. So it seems like a topic that's worth discussing about. So if you guys have particular things that you want me to touch base on as we're going through, feel free to let me know.
Hey, Emily, how often do you, in your work, have people come in with cycling related injuries?
More often than I would like to say. I see some people that have crashed on their bike and might have had a fracture of their wrist, or I hear of people having clavicle fractures often. But a lot of times it's these more like chronic types of conditions that are inhibiting people from being able to cycle and do what they love. So, arthritis impacts a lot of people. And if our exercise is good for arthritis, but if it's preventing you from being able to do what you love to do, then it becomes a problem. So trying to figure out how you can modify is really important, I think. But I might not see a ton of people that have had like accidents related to cycling, but so many of my patients bike. So it always seems to come up. So I'll just run through a few of these common shoulder diagnoses that we see often. And you've probably heard of some of them. So arthritis in the shoulder, adhesive capsulitis is something that you probably don't want to end up getting. It's when your shoulder freezes and can take several months, if not years, to kind of unfreeze. Instability is when the ligaments are loose. And then, like I said, then looking at traumatic injuries, like going over the handlebars or hitting a tree and falling and reaching out, is when we really see like issues with some of these other types of fractures. So your AC separation, so your that would be right here, and you might have like a sprain in the ligament right here. A labral tear is your labrum's basically like a tube, I suppose, that's I don't know if you can see my arrow, but it's basically at the top of the head, the humerus bone, where it goes into the clavicle, and it sort of creates like a suction. So if people end up crashing, you might end up with a labral tear and a humeral fracture. So this is your humeral bone here. And then clavicle fractures are through here. And I won't get too into that. I just urge people to be a little bit careful.
Emily, as you're showing us things, we can see your arrow pointer, although it's white on whites, but when you move it a bunch, it becomes more visible. But then also, as far as the camera, like we see your face very well, but we can't see below your clavicle.
Okay.
So if you're gonna, if you want to like show us reference parts of this in your own body, then just maybe be aware of that as well.
There. Is that better?
Yeah, yeah. It's off to one side. You're not centered in the camera, but it is better.
Well.
Oh, there you are. Now you're centered.
My husband bought a computer that's like huge, so it's throwing me off a little bit. It's probably like, it's really big. So, all right, we'll go to the next slide. And the most common problem that people have with shoulders is your rotator cuff problems. So those can be anywhere from impingement type things to tendinitises to like a torn rotator cuff muscle. And we see these all the time in the clinic. It can often be because of it kind of a degenerative process that just gets worse over time. But it can also be a traumatic sort of thing if you were to fall or something like that. It's often aggravated by lots of overhead activities. So if you're painting your house and you haven't been doing much physical activity, then you might end up kind of hurting your rotator cuff muscles. And I won't go through all those, but they're basically the muscles that kind of support that glenohumeral joint right there and kind of keep it in place. So if you have a rotator cuff problem, you're probably going to have pain going out to the side, lifting your arm up, reaching overhead, stuff like that. And sometimes you have night pain, pain at nighttime too when you're sleeping. So zipping through these, I think put these in just so you could see the different bones. And the forearm has the two bones down here, the ulna and the radius, and the ulna is fixed and the radius rotates around the ulna. So a lot of times people end up with fractures down in the end of the radius right here. That's a real common one, especially with falls. I put these ones up so you could kind of see the depth of the muscles in the forearm. You have tons of muscles here, and these white parts, those are the tendons that go down in your hand. So some of the tendons start up at your elbow and go down to your fingers, and then you have other ones that are just in your hand. So when we're looking at what's going on with the pain, you know, we're looking at all of these things like, okay, what is the issue going on? And it can be a number of these, you know, it can be a number of these tendons. So I just wanted you to see the pictures of kind of how elaborate it was. And so some common elbow injuries, tennis elbow and golfer's elbow. So if you have pain on the inside here, it might be like a golfer's elbow type of situation. And then tennis elbow is on the outside here. And usually it's right on those bony prominences right there. And then we've got to look at our nerves. So they come off of your spinal cord and run down. And they go under your clavicle, and then they kind of separate into a couple different ones. And the ones we usually talk about are your median nerve and your ulnar nerve. Those are kind of common ones that are issues. So you might feel a common thing with nerve issues is like the tingling in your hand or your fingers, and like an electric shock type of pain. I'll skip the arteries, but there they are. So I feel like I hear a lot of people have numbness and tingling in their hand and down their arm with cycling. It can come from different areas, and there's some common places that they get a little bit hung up, depending on which fingers you're having issues in is going to determine where the issue is coming from. So this is your brachial plexus, where it comes off the cervical spine. And this can involve entrapment of the nerves, the blood vessels, and the arteries, but normally it's just the nerves. So it can kind of get stuck in your scalene muscles through here, and also under your clavicle, between your clavicle and your first rib. So you'll notice, so with something like a thoracic outlet syndrome, your whole hand would probably be going numb. It wouldn't just be one finger or two fingers. And these are some of the other symptoms you might be having. And then here's a couple tips for if you're having something like that. Posture is a huge thing for this. So if you're sitting at your computer desk, you know, typing and working all day like this, and then you get on your bike and you're sitting like this too, you're in this forward flex position, and those scalene muscles and the pec muscles are tight, and they're kind of compressing the area that those nerves go down. So you want to check your posture throughout the day. And I always tell people, like, I don't expect you to like maintain excellent posture all day long, but the more times you can check in and just kind of see how you're doing with your posture, the better it's going to be. You know, find your good posture and hold it a few minutes or so, and then go back to doing what you're doing.
The person in the purple there, is that type, what is that picture showing us?
So she is stretching her scalene muscles through here. So she's adding a little bit of depression to her shoulder, and then tipping her head to the side and rotating back a little bit like this to stretch those muscles through there.
And then the other person looks like she's lying on a roller, a foam roller.
Yeah, so this is a good one to stretch your pec muscles. You can also use it with like a rolled up towel, and just lay on the floor or something and have it along your spine and just use it as an opener to stretch through here a little bit. And then some of the other techniques for stuff like this is using diaphragmatic breathing. So you're doing like your belly breathing as opposed to breathing and using the muscles like your scalene muscles. So that can also be helpful. And then working on strengthening some of your posture muscles and your upper back muscles can be helpful too. And I won't go too into that because I know you had a great webinar a couple weeks ago on stretches and stuff, but these are a couple good ones, I think, to just kind of combat that biking position that we're in so much throughout the day.
Especially those, don't we all want to be in that biking position all day long? That would be the dream. Of course, then we would have a lot more stretching to do as well.
So
I'm sorry, Emily, before you go on, can you just talk about the safe sleeping positions?
Yeah, so when we're looking at different nerves, I like to try to think about like creating a little bit of space. So having like a pillow in between your arms so you're not kind of compressing down in that area where the nerve might get tight. I think sleeping on your belly is probably not a good position for thoracic outlet syndrome. Stuff like that. And then we'll talk about it a little bit more when we're talking about the ulnar nerve too. But basically, you want to avoid sleeping with like your elbow really flexed because that's going to put a lot of tension on that nerve. And you want to try not to sleep in these like end range positions because then you're going to be just aggravating that nerve too. So that's why some people will wear like a wrist brace at nighttime to keep their wrist neutral instead of so they're not like curled up like this basically.
That's
So
helpful.
it does
Thank
the
you.
opposite. Is that right, Emily?
What?
We couldn't see your hand in that last. You're saying that your what the brace actually keeps your hand open.
Ideally it keeps your wrist straight. And yeah, I mean, sometimes with your hand open can also be helpful too. But you basically want to think about those nerves like not being super lengthened and not being super shortened and tight. So, yeah, hopefully that helps a little.
It did. Thank you.
All right, so the median, so like I said, it breaks into a couple different nerves down there, and the median nerve is what's involved with carpal tunnel that you hear all about all the time. And I like this picture because it shows this is the orange and yellow median nerve going through, and you have 9 tendons that go through that space too. And it's a really tight little space and there's no room for inflammation in there. So those are the tendons that I showed you in that picture before with coming up from your elbow and down into your hand. So this would be, so here's a picture of the sensation changes in your hand. So you might have with the median nerve, you might have tingling in your first, second, third, and half of your fourth finger, right here. And then your ulnar nerve would be your fourth finger and your fifth finger. So that can kind of tell you which nerve you're having problems with. So, and we treat them differently depending on which fingers you're having issues with. So there's different exercises we do for carpal tunnel syndrome, but basically avoiding extremes in wrist position. And this also goes with sleeping, with working at the computer, when you're on your bike, That's something we'll talk about a little bit later on. Like when you're typing at your computer, you don't want to have your wrists back like this or forward like this. You want to try to keep them neutral so you're not putting extra tension on that nerve through there. A sustained grip on things is also an aggravator for the median nerve. So if you're biking for a sustained amount of time and you're gripping your handlebars really tight because there's a lot of cars going by, or you're riding somewhere new, or you're nervous, or riding some technical stuff, if you're just gripping really hard, that's going to flare up that nerve as well. So trying to loosen up, take breaks, and then thinking about what else you're doing in your day that might be aggravating it. So using things that vibrate can make it worse, like the lawnmower, stuff like that. So it might be helpful to wear gloves, and we'll talk about that in a little bit. And then here's the ulnar nerve. So that would be your pinky and half your ring finger. And this is something that a lot of people end up with this type of problem too. So that the cycles palsy that they talk about is with compression right here on the pinky side of your hand, at the base of your palm. It's basically when there's a compression in that area. So you can see when you're holding the handlebars, that's a spot that sometimes gets a lot of pressure to it. So, and then the other one with the ulnar nerve is also often up at the inside of your elbow. So that might be another spot where it gets a little bit stuck or compressed. So we want to avoid any direct pressure. So I think about like when I'm, riding in the car, you don't want to lean on your elbow because that nerve is really superficial right there. So any sort of pressure, you're just pushing right on it. So
that's the funny bone that we kind of remember since we were kids.
Yeah, like right in between the bones, actually. Yeah. So that can kind of be a spot. And then if you're riding for a really long time and you're putting a lot of pressure on that nerve on your hand, that's going to flare right up too. So thinking about that, especially if you're going for a long ride. And so that's that one. So another thing that aggravates the ulnar nerve is sustained elbow flexion. So talking on the phone, people's hand goes numb. Just keeping your elbow flexed like that for a long time. And that's why we talk about sleeping. You want to avoid sleeping with your elbow fully flexed like that. And then repetitive elbow bending too. Because even if you're having a problem with the nerve down here, you want to think about if you're also aggravating it up a little bit higher too. So, and with all of these, thinking about your posture as well, because that's going to impact it. All right, we're cruising through these. So there's different exercises you can do for the nerves, and we call them nerve glides. And basically they help glide that nerve through that space because it goes through a lot of like soft tissues and stuff. So it helps it move freely, basically, through those areas. Which I can go through it later if you want. Those are all your carpal bones. So each of these bones they're all in your wrist and they're all connected by different ligaments. Tons and tons of ligaments through here. So this is the end of your radius where people often have a fracture there. And if people have sprains in their wrist, usually it's these ligaments kind of connecting the wrist bones together. And also you can end up with arthritis in between some of these bones too. So I already sort of talked about the distal radius fractures, but this is a really common one. It's they refer to it as a foosh, which is a fall on an outstretched hand. So if you end up falling off your bike and land on your wrist with your hand out like this, chances are pretty high that you could end up fracturing your wrist, especially if you have osteoporosis too. And then these are some of the other common fractures in those wrist bones. There's different ones with each of the bones. One of them is the hamate stress fracture. So that I think about if I'm mountain biking or something and you're going over rocks and repeatedly getting pressure right on this area through here, you can end up with a stress fracture right on that bone right there too. So. These are a couple other diagnoses that people end up with, like a tendonitis. So if you have pain right through here, that's often a common place for tendonitis, which is called Dequere veins. So I think about that. If you're riding your bike and you're holding your handlebars on the top part and you're bending your wrist down this way, you could end up kind of developing Dequere veins through there. And the test for that is by grabbing your thumb and then tilting down, and you'll feel like a sharp pain right through there. And then just, these are the little muscles in the hand. I won't go into all of this in detail, but metacarpal fractures, I've actually seen quite a few from biking accidents, like if you hit a tree or something like that. And with all these sorts of fractures, you want to make sure that you get good care for it right after. Go see an orthopedic doctor and make sure that you get a good consult for the type of fracture it is and if it's displaced, because you start healing within the first couple days, and if you wait too long, then you won't be able to have the surgery. And sometimes surgery is the better option. You can actually get it moving a little bit quicker if they put in like a plate and screws, and then have less complications after. And even with like finger fractures, people tend to think that it's like no big deal. I've just, broke my finger, it'll be fine. But if they're not treated properly, you can really end up with some deformities and issues later on down the road. So it's definitely better to get it checked out, so you don't end up with issues down the road. So, and then trigger finger, a lot of people end up with trigger finger. That's basically when you bend your finger down and it catches when you try to bring your finger up, or you can't bring it up and you have to passively bring it up. And it's basically an inflammation where that tendon goes through a pulley right there. So if you're biking, that can end up making it worse with that sustained gripping as well. And that's something that's treatable conservatively as long as you do it in the first few months of having the problem. But once you've had it for a while, it's a little bit harder to treat, and then you could have a release to have it fixed. Dupuytren's, I just wanted to mention because I am so surprised at how many people actually have it. I didn't even know it was a thing. But it's actually when your fingers curl. Usually it's these ones and these two, and they bend in, and then you can't lift them out. It's a contracture, and something like that gets in the way of putting your hand in your pocket or holding the handlebars, and can make things a little bit difficult. So This is a big one too, arthritis in the thumb. This joint right down here, this is your CMC joint. Sometimes you can have a bony prominence there. It hurts when you pinch. So some of the strategies for that would be like making sure you have good padding on your handlebars, replacing the tape frequently. And trying with all of these things, trying different types of shifting to make it a little bit easier.
Yeah, we can go into that maybe a little bit more even, Emily. But for those that don't understand or aren't familiar with, there are lots of ways to shift gears on a bike. Like there's grip shifts where you grip the handlebar and actually twist a shifter. Trigger shifters would be like where you'd be using your fingers, kind of like a trigger on a gun, but you're releasing or pulling cable. And then the latest thing is with an electric drivetrain, which can be wired or wireless. All you're doing is touching a button, like on a remote, and it controls electronically a little motor in the derailleur part of your drivetrain to actually change the gear. And one of the nice things about that is that it takes very little force on the part of your hand to do it. So if it hurts to push with any force with your fingers with a conventional gear shifter, then something like an E shifter might be really helpful. And you also mentioned on there too, Emily, that the size of the grip or the handlebar. And so I have really big hands, but people also have really small hands. And there's lots of ways to change the ergonomics of a bicycle. You can bring the handlebars, you can get narrower grips on the handlebars, or you can get a thinner tape if you're using a road bike drop style handlebar. So that would be good if you either prefer a small grip or if you have smaller hands. The opposite's true too. You can get very big grips or very thick tape, or even do 2 layers of tape on a road bike drop handlebar. Brake levers can also be changed so that they're closer to the handlebar, so you don't have to reach so far if reaching and stretching is uncomfortable, or if being able to reach the lever causes you to have to change the orientation of your wrist or arm in an uncomfortable way. That can help. So, a local bike shop can help with figuring out any solutions to any of those issues.
And I brought a couple different grips too. Yeah, I'm not familiar with the electronic shifting, but I think it's like really, really easy to use. I think it's just like pushing a button. So I think that would be great for some of these issues.
It really is delightful. Not only is it as easy as pushing the button on a remote control, but it works so well every time.
Yeah.
There's none of this like, oh my gosh, it's like click, 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 click. It's not changing gears yet. So the negative to electronic shifting is the cost. It costs quite a bit more. And of course, like if it's not mechanical, it's not old fashioned, and it's a pretty new tech. Cool new tech, but still new and expensive.
Yeah. I just thought I'd show this because this is one of my favorite braces for that arthritis in the base of your thumb. So it's called a push brace. If you're having that, I'll come back to the kinesio taping, but I figured I'd put it in there because I have used it so many times, and people just say I put it on and they're just like, wow, that makes such a big difference. And I'm like, are you just saying that to make me happy? And they're like, no, it helps. So I always throw it out there as something that might be able to help somebody. And maybe it's just something that you put on when you're biking. And you can put it on different ways, and there's different techniques to it, but I won't get too into that. But I've just seen it work so many times that it's worth mentioning. So here's a couple different ways you can put it on. So that would be like for like a rotator cuff issue. This would be for like your golfer's elbow or that ulnar nerve issue. And then like a carpal tunnel type of taping.
Do they make an adhesive, a tape that is actually reusable? Or and I guess that's the first question, but and I also feel like I've seen clothing almost that has like this sort of technology built into it, or technology, whatever you might want to call it. Is that true? Does that actually work, or is that sort of like, nah?
I don't know about the clothing one, but I just buy like a roll of tape like this, and it'll last a little while. So, but maybe you're thinking about like compression type of shirts or something. I don't know.
Yeah, I feel like I've seen pants and shirts that have this sort of design on them, but maybe it's just aesthetic. It's not actually doing anything.
Well, usually this will last a few days when you put it on. It should last like 3 days or so, and then it just kind of peels off.
So
Is it
Emily, do you
possible to
know, oh, sorry.
go ahead, Louise?
Do you know, I'm allergic to adhesive, so I have a hard time with the tape. So do you know if there's any that are non-allergenic in the adhesive?
Oh, that's a good question because I hear that often. I'm not
Yeah,
totally
I
sure.
break out big time.
Yeah,
I do Band-Aids.
that's unfortunate.
Yep.
I'll have to ask around and see, but none that I can think of off the top of my head.
Yeah, I hadn't heard of any. I've kind of, asked a few people too, and nobody seems to know of any. So, okay.
Yeah.
Louise, maybe what we can do is Emily, if Emily finds any information, we will get in touch with you through email, and so that you can find out the answer.
Yep.
Hey, Emily, with tape, is it possible to put tape on independently, or do you always need someone else to kind of help you do it?
It depends on the technique that you're using. Generally, you probably need someone to help you because you just want to get the tensions right.
And so what's the best way to, without making an appointment to see Emily Odermann every single time you go for a bike ride and want to put tape on, what's the right process to learn how to use tape, or any of these solutions? Is the best way to set up a initial appointment and kind of learn it all, and then
Um,
do it on your own or with a friend in the future?
well, I got some of the basics for kinesio taping here. You basically you can put it on different ways, but I don't think we have time for it tonight.
Okay.
But I hate to say it, but YouTube has tons of kinesio taping videos, so that would be a good place to start, probably.
Okay, yeah, as far as getting the process of like how to apply the tape, where to apply it, how much tension to put on it.
Yeah.
Yeah.
Yeah, so it's not like athletic tape. You're not like wrapping the joint and you're not putting a ton of tension on. You're actually just putting a little bit of tension usually just to kind of support the tissue a little bit. And you want to be able to go through the full range even with it on. So you're not immobilizing your joint at all. And usually it's only like 20% tension. It's not like fully stretched. But maybe you should have a webinar on just kinesio taping.
Sure, we can do that.
So these are all things that you can do. Some of these things you can do. So padded gloves to decrease the vibration for the nerve issues. Stretching, there was a good webinar previously. Nerve glides, like we talked about for those nerve issues. Kinesio taping, different braces. Changing your position frequently is going to be really helpful so you're not just compressing the same area the entire ride. And then looking at things that you can do when you're not on your bike that might be impacting it. So when you're at work or when you're at home, are there different things you can change up when you're not there? So we can kind of skip that, but we'll get to. So it might be helpful to get a real diagnosis from your doctor, and you can always go see a therapist for some additional ideas and treatments for something like that. you could even bring your bike in and have them look at it with you. And they can do other stuff when you go in, like massage, cupping, dry needling, and different modalities to really treat whatever's actually going on. I'm not going to be able to get into that on a webinar completely, but and then when we're looking at the bike, which is probably the stuff that you guys are actually interested in, 2 out of your 5 contact points are your hands. So a lot of, they're important for your ride. So making sure they're comfortable. Does your bike fit properly? You basically want your torso to be about at 50 degrees and your shoulder angle at 90. And you want to make sure your elbows are a little bit bent and not locked out straight. And then your wrists, you want to have neutral. So we talked about that extended or flex position. So you're going to want it somewhere in here. And you also don't want to be angling side to side too much either. So can you rotate the grips a little bit, like Eric was saying, or you can even like cut your handlebar down if your hands are too far out and bring it a little bit closer.
That's a really big one, especially in the last few years. We've seen bikes get really, especially mountain bikes, have got really long, and the handlebars have got really wide. And so handlebars typically come in, what new bikes will have just really wide handlebars because you can cut them down. And if they put short handlebars on, you can't make them longer. So they make them really long, but very few people actually take the extra step to figure out, well, where do I want my hands to be? And then secondly, how do I cut the extra handlebar that I don't need off? So even big people don't necessarily need the full width handlebars that come on many modern mountain bikes. So one thing that I've heard, and it works for me, is that when you're riding a bike, maybe you want to be like when you're riding a bike in sort of like more of a aggressive position. So if you're just cruising around on the beach, it might not be the same thing as when you're actually going down the trail or when you're going down a hill on a road bike. But generally what I've heard as a rule of thumb is that you want your wrists to be sort of in front of your elbows. If on the other hand, like your wrists are way wider than your handlebars, that might immediately put your wrists in a weak position and your upper body in like a sort of ergonomically weak position that will feel uncomfortable. It's going to limit how well you can control the bike, and it's going to lead to some of these issues that Emily has talked about. So again, like going back to like the bike fit idea, like a bike fit is something that you can go on YouTube and check out. There's lots of like information on the internet, but a lot of bike shops are set up to help you figure this stuff out. And so you can go to a bike shop. A lot of them will do professional fits. Some of them charge, some of them don't. You can get a different level of fit depending on what you're looking for at different shops. But explore that if you're having issues, because there are a lot of adjustments that we can do to our bikes that if you're not familiar with it or you're not willing to take that plunge, because it can be kind of scary to hack off with a saw like part of your handlebar. Get some confidence by talking to somebody that knows about this stuff.
Yeah.
Thanks, Emily. Sorry, took a lot of
No,
time.
that's good. I didn't realize there was so much you can adjust either. Like I have small hands, like you said, and just reaching my brakes were way out here, and I was able to bring them in a little bit closer, and just that made it easier. So, and then here's a couple of different grips. These are more like ergonomic type grips that are wider, and it just helps to disperse the pressure a little bit. So that's one. And then these ones, so this would be your handlebar here. And then if you want to change your position to grip on the side, just to change the position a little bit. And so those can be helpful. And then I thought gloves are just kind of a fashion thing, like the jerseys and stuff, but they're actually really helpful for biking, and they've got the padding here so the nerve can go right through the middle without compressing the nerve. And it also helps with the vibration, which can impact the tingling and stuff like that too. So I wear them now all the time, and I even sometimes wear them inside on my trainer. So
gloves are good too. I find that a glove prevents that slippery feeling on the grip that could then lead to like over stressing your grip and like
Yeah.
having sort of this maxed out, like uncomfortable hand and forearm. So having gloves let you have a looser grip on the grips so that you can ride more comfortably and not
Yeah.
have issues afterwards.
That's important because those were a couple of the things that caused the problems, like the sustained grip leads to carpal tunnel or can lead to trigger finger. So the looser you can be, the better. So if the grips help with that, that's a great thing. Couple other tricks that you can do. Sometimes people actually overinflate the tires and that can create more vibration. So depending on if you're riding on the road or on the trail, sometimes it's helpful to have kind of a lower pressure so that it's not vibrating so much. And you can change the stem height so that you take some of the weight off your upper body a little bit. You can tilt the seat. You can always try a different saddle. And then if you have a shock fork on the bike, you can adjust the suspension a little bit on there.
With saddles, what I often try to do is keep it so that I'm balanced on the saddle. If I'm like sliding forward or back off the saddle, then I find that I'm using my hands and my upper body to really like keep myself in the position I want to be. So
Yeah.
find a place where your saddle can support your upper body without you sliding forward or backwards on it.
Mm-hmm. And then making sure that your bike is tuned up properly so you're not working harder than you have to be. Is your chain lubed, and is your bike, do you clean your bike regularly so you're not having to grip harder than you need to? And are you riding the right type of bike for the terrain you're on? You know, that can make a big difference too. So these are just kind of some things to think about that can make a difference in your ride. So having it in good shape so that you're not working harder than you have to. And then looking at electronic shifting, if that's something that you might need, or e-bikes. I think e-bikes are a great thing for people that are having trouble with their upper body, because then it basically just gives you a little extra juice in your pedal stroke so you don't have to work quite so hard. So if you're having issues with your arm, that could also help. So, and they're a lot of fun. So I think that's about it. So if anybody's got questions, wow, I wasn't sure if we would get through all that, but.
We did have one question, and I think we covered some of it. This came in early on. This person says they suffer from chronic right hand pain related to cycling. Since receiving cortisone injections several years ago, I was able to mitigate the severity of pain, but pain remains part of my post-ride experience. Any suggestions?
Well, if you had a cortisone injection, then you probably saw a doctor which told you the diagnosis. So depending on what the diagnosis is, would sort of determine what I would suggest. But if it's related to like a tendonitis type of issue, some just wrist stretches might be helpful to do afterwards or beforehand. And a lot of times if we're thinking about arm exercises, we don't really often work on our forearms, but I often have people doing wrist curls, kind of doing wrist curls back this way and this way to get those forearm muscles that we showed you that picture of, because having the strength in your forearm might be able to help with something like that a little bit. So, and I also often give people putty exercises and grip strengthening exercises to work the muscles in the hand too. So something like that might be helpful.
Does anyone else have any questions? Feel free to unmute yourself or enter your question, comment into the chat window.
Hey, it's Louise. I have a question. So I'm a computer analyst, so I'm mousing all day long. And at one point a couple years ago, I got a really bad case of, I guess you'd call it tennis elbow. And biking really aggravates that. So I find that when I'm biking and my elbows are bent, it puts a lot of pressure on my lateral part of the elbow. And so I end up going from the top bar to the bottom bar and then straightening and locking the elbow and bending the elbow. Is there anything else you think during riding that I could do to try to, I've also worn my elbow brace, but then I came home with a big bruise from the pressure. So that didn't work. Yeah, any thoughts on that?
When you say an elbow brace, do you mean like a compression, like
Yeah.
a counterforce brace?
Yep.
My first thought would go to something like that. A lot of times people put them on incorrectly. So I don't know if,
I could have had it too tight too for what I was, for cycling.
yeah, I mean, you basically want to be able to stick a finger under there and you want to have it right over these muscles right here.
Yep.
It
It also has a little balloon in it. So
yeah,
maybe I should have taken the balloon out.
it's okay there.
Oh, it is. Okay.
Yeah, I'll have to think about that, but also there's some really good exercises for tennis elbow. So
Okay.
ideally it's something that you could just get, treat and be done with,
Yeah.
as opposed to modifications.
Okay.
So I can give you some exercises sometime.
Okay. Sounds good.
Louise, do you find yourself, can you find a comfortable position while you're riding a bike, or is any position on the bars uncomfortable?
It kind of depends on the distance and the terrain. I prefer to road bike than trail bike. But I think I grip so tight on the road because I'm afraid to hit a pothole or hit a rock or some sand, that I might be overdoing it too much and it's stressing my arm too much more. I don't do that as much when I'm on the trail for some reason. I'm more relaxed. And I don't know, when it gets to the point that it just hurts that bad, I just stop for a while, shake my arm out and, then hop back on and keep going. And usually ice it when I get home, but
Well, one thought I have is if it doesn't hurt so much when you're on the trail, it could be the style of bar. There's a lot more leverage on a flat bar, the type of bar that would be on a mountain bike because they're wider
yeah,
than a road bike. So you might feel inclined to grip a road bike drop bar more for fear of that lack of leverage that you're used to on a trail bike. So one thing you could try to do is get a wider bar for the road bike. You could even put a flat bar on the road bike. It requires changing over the shifters and brake levers, but it's definitely not a forbidden thing. People do it pretty commonly, and manufacturers even make flat bar road bikes now because there are a number of people that prefer it over a drop bar. You can
yeah,
also get a wider drop bar. If you get a wider one though, one thing to consider is that a wider bar is going to actually increase the reach from the saddle.
yeah,
You might need a shorter stem to compensate for a wider bar, but going wider with a bar might give you that extra leverage that you don't have, so you don't feel like you need to death grip the handlebars so much, and maybe that would help you feel more comfortable, in addition to the exercises that Emily also suggested.
good ideas. Thank you.
How long have you
Hello.
had it for?
Oh, it's been
Hello.
a couple years and it's on and off. It
Yeah.
just flares up depending on activity.
Yeah.
Hello, I have a question.
Hi, Jerry.
I'm an older biker, but I've been biking many, many years. But I have the problem with the median carpal tunnel issue for many, many years. My question is very simple. Can carpal tunnel surgery help with that? Because I've tried many, many things over the years.
Yes, some people have very good results with the carpal tunnel surgery. I probably see the cases that don't work out very well, but a lot of times people don't even need therapy after that type of surgery. So usually I just see people if they have like a lot of scar, like if they're prone to scar tissue issues in there. But I've heard a lot of people that have some good relief with the surgery. And it's pretty simple too. I think the recovery time is pretty quick after something like that.
How do they diagnose that? Do they do like a scan or something to determine if that would help?
Yeah, so when we're looking at the nerve, before they do surgery, they want to figure out where the compression's coming from. So is it actually at the carpal tunnel, or is it higher up? Is it coming from the neck or the arm? So there's different tests that we can do, like tapping different places and putting your hands in different positions to see what increases the symptoms. But they also will do a EMG test to test the conduction of the nerves. So that's a good test that they usually will do before surgery.
Thank you.
Does anyone else have any other questions? Both of us are available at other times. So you can see our emails, and my cell phone number is also listed on this last slide that Emily is sharing. So don't be shy. If you think of something later on, you can get in touch with us. And lots of great information. Thank you so much, Emily, for joining the webinar and sharing your expertise with us all. And
Well, I'm happy to be here. It's definitely like this impacts a lot of people, so I think it's an important topic to talk about. And we definitely can't cover everything in an hour, but if you have any questions, feel free to reach out, and hopefully I at least gave you some things to think about a little bit, like what is going on, and can you change something about you with stretches and exercises, or can you change something about the bike, or can you adapt or try a different technique to make it a little bit better? So, but there's lots of information out there. So feel free to, if you want to YouTube tendon glides or nerve glides, or if you want to send an email, I can probably send you some links too. So.
great. All right. Well, thanks, Emily. A couple people said thanks in the chat also. Really appreciate it. So thank you, everyone else who is attending, participating in this webinar. And I hope that we can see you out there on the bikes, and also maybe in the next webinar. And if you're a woman, check out the women's ride this weekend. So have a great night, great rest of the week. Enjoy this wonderful weather that we've been having.
Thank you,
Thanks
guys.
again, Emily.
Thank you.